Okay, good question. Penis enlargement, yes, it is possible. We have two types of penis enlargement. We have surgical option, we have the non-surgical option. And there are two different ways of doing it. Surgical is the oldest way of doing. It's been happening for so many years now. And basically, surgeons take some fat through something called liposuction, usually from the abdomen of the patient, and then process this fat, wash it and so on, and then re-inject that fat in a specific plane, which I'm going to show you now exactly where so this is the penis here. Okay, so this is the muscle, and that's the skin here. The plane exactly in between the muscle and the skin, this is where they inject. So they don't inject it inside the muscle of the penis. No, they inject it in the area between the skin and the penis, or the penile muscle. Now, there is a ligament here called suspensory ligament, and you can see that ligament up here. And the suspensory ligament is the ligament that retracts the penis. In cold weather, for example, the penis is retracted in, and also the scrotum. But the penis is retracted by the suspensory ligament, and also the suspensory ligament is responsible for making the penis erect in a kind of 90-degree angle during erection. So what is usually accompanied by the surgical procedure for penis enlargement is something called cutting the suspensory ligaments. So they cut the suspensory ligaments so the penis could dangle down a little bit more, so it could look much better or much bigger than what it is, and then they fill these areas with the fat. Obviously, it is a surgical procedure. It has its pros and cons, and it's been done for so many years, and there's been thousands and thousands of cases, successful cases and non-successful cases. But what I would like to talk about mainly today is something called non-surgical penis enlargement. And this is probably has been going on for a few years now. We started slowly, but now quite a few doctors around the world are doing the procedure. So instead of filling this space between the muscle and the skin with fat from the patient, we fill this area with something called derma filler. And the derma filler is made from mainly from a material called hyaluronic acid. And hyaluronic acid, we all know hyaluronic acid, which we inject the face with, the cheeks or the chin or the lips. It's basically a non-protein material like carbohydrate, like a polysaccharide. And when I try to explain it to the patient, I tell we all have hyaluronic acid in our body, and this is the material that our collagen swim in it, if I would like to be more specific. So we have these hyaluronic acids done in lab, and we take these injections now, and just like we are injecting the cheeks, the chin, the lips, the hands, everywhere, and the Botox now, we've been doing it for the Botox for so long, we inject this space and we create penis enlargement with it. Very good question. It's a very simple procedure. It's about 15 minutes. What happened is I numb the area just for topical anesthesia first, and then I come with a numbing injection again, and I just give 2 injections on the side of the base of the penis, and through that side I go with a cannula inside this area, and I fan the whole area with the hyaluronic acid. So I inject inside and I come out, inject as I withdraw. So I fan the whole area with hyaluronic acid. Usually I give about maybe 15 to 20 ml as a starting point in order to see a little bit of difference. Now, the penis filler is extremely good for increasing girth. So the girth is increased in both flaccid and erection position. But it also gives increase in the in girth, it gives increase in length in flaccid position. And I will explain to you exactly how this happens. So, you know, as I told you that the penis shrinks and then extend or expand during erection. So there's like an accordion space that happens, or accordion movement that happens. So the skin around the penis are quite thin. When I fill the space here between the muscle and the skin, this skin becomes a little bit thicker. Not actually, but that space becomes thicker. So when the muscle retracts, or when the penis retracts, because of the thickness all around the penis, it's not able to completely retract fully, so it remains flaccid. And by remaining flaccid, that gives the patient that has satisfaction of having a much longer flaccid penis than when he has it without the filler. And this is actually has a very big psychological impact on a lot of patients in the shower, for example. So I do a lot of footballers and you know, sports people. So in the shower, they take shower together, they look at each other, and he wants to have this confidence that, you know, it doesn't look too small when it's shrunk. He could be very happy with the size during the erection, but during the flaccid position, he doesn't like it. So this gives him this kind of satisfaction. Plus, the girth is increased in both cases, the flaccid and the erect position. Excellent question. So painful? No. I told you we give numbing injections at the beginning, and the patient doesn't feel anything at all. What he needs to do after that is something called massaging. And if you don't mind, I have a model here that I would like to explain exactly how patients do massages. I call it, my own terminology, I call it the shish kebab massage. So if we look at, this is the penis here, let's say I have put the filler everywhere. Now, in order for this filler not to create any lump or asymmetry, I first massage the penis very, very good in order to become cylindrical. All the filler becomes cylindrical and symmetrical. And ask the patient later on to hold the tip of the penis and keep massaging the penis like this shish kebab. So it's not up, it's not down, it's like this exactly. By doing that, you are actually making sure that the penile, or the filler that I've injected, is symmetrical and cylindrical around the muscle. So this is the homework that the patient do, and I'm not asking him to do anything more. Second thing, there's no sex for at least 3 to 4 weeks, because if we have sex during this period and the filler is still a little bit moldable, during the intercourse, the filler will be pushed at the base, and then it's not going to be symmetrical. So it's very important that we stop sex. I tell him not to go into a sauna, jacuzzi, hot bath, or stuff like that during first at least 2 weeks of the treatment. So these are the post-treatment protocol. And apart from that, he can just no sports for about 1 week as well, because I don't want him to get sweaty and might cause any infection in the area. Apart from that, there's nothing else that he should do. The result should last for about probably 12 to 18 months after the treatment. It depends really on how active or sexually active he is. But what I tend to see in my clinic is that the patient comes for the first time, he sees the result, he gets very excited. Then he never waits for 12 months. He comes before that, because he wants to keep increasing the size. I have patients who reach almost 150, 160 ml of filler, and they are very, very happy with the result because of this massive boost in confidence. The great thing about this treatment is it's very, very simple. As I said, it's about 15 minutes and they go back to the work straight away. There is no downtime of any surgery or anything like that. Almost everybody, yes, almost everybody could have it. Obviously, there are some contraindication. If there's any sort of autoimmune infection in the patient or autoimmune disease in the patient, we need to check this out because it might not be suitable for him. Also, if there's any active infection or active lesions going on, I cannot do that. For immunocompromised patient, it will definitely be an issue. So we would not proceed with this. If patient have any allergy to the filler, for example, he had any filler in the past and he has allergy, of course, this will not be able to go ahead with this procedure. If the patient have a bleeding disorder, so he bleeds a lot, probably we need to discuss it more with his doctor to make sure that we could switch him to something else, or how, because even patients who bleeds, they still go for surgeries and have surgeries. So this needs to be discussed with his doctor first before proceeding for such a procedure.